The following segment is sponsored by the Dermatology Associates and Surgery Center.
And welcome to today's edition of Ask the Expert. I'm Shea Paul, and I am being joined by Alex Epperly with Dermatology Associates and Surgery Center. Alex, how are you?
Good.
Haven't seen you in a while.
It has been a little while.
Yeah, you haven't been on with us in a while, so we're very happy to have you with us. We're going to start a series of discussions, a weekly series, pertaining to skin conditions and ailments that we frequently see during the summer months or during the warmer months. We're going to talk today about a common condition known as melasma. Now, melasma, I've heard of that as being what they call the pregnancy mass. But in fact, it doesn't just affect pregnant women. It can affect men, children, anyone, correct?
Yeah, so melasma is an acquired disorder, normally of hyperpigmentation. It normally affects sun-exposed areas, and it's most common in females during reproductive years.
Okay, all right. So what causes this condition? Yeah. And what does it look like, I should say? What does it look like first?
So it normally looks like tan to light brown macules or patches, and we'll normally see it on the patients, like their forehead, their cheeks, around the mouth. As far as causes, there are a few things that we think are causing it. Increased estrogen by either pregnancy or oral contraceptives. Thyroid disease can cause it. UV, sun exposure, and then different medications can also cause it as well.
I see. Okay. So when a person gets this condition, is there a treatment for it? Is there anything you can do there?
Yeah, so a lot of times we have patients that will come to the office, and it's a benign condition, but it really affects them emotionally and psychosocially as well. So they will come to our office, and we have different topicals that we can do that can lighten the area. We can recommend different like chemical peels or laser treatment that will lighten that as well.
Okay. Does it ever just go away on its own?
It kind of comes and goes. The main thing with that is prevention. We need to make sure that you're preventing against sun exposure, using a sunscreen, 30 SPF that protects against UVA and UVB, wearing like a wide brimmed hat, avoiding peak hours of sun exposure are really important in managing patients with melasma.
I see. But now a pregnant woman, after she gives birth, since obviously she can't really control being pregnant, have you seen that just go away on its own?
Well, a lot of the times it will self-correct, but
when they're not getting that estrogen, as much estrogen production. Okay. So do you see it more in the summer months? Because I'm assuming because of the UV exposure, more people are spending time in the sun.
Yeah, we do. We see it a lot. A lot of times you'll have an influx spring and summer, and that area will kind of darken, and they just want kind of even skin pigmentation. So we compound quite a few creams that we use that do a really good job evening out the pigmentary areas.
Gotcha. Okay, Alex. So if any of our viewers out there might have this condition or know someone suffering with this condition, obviously they could see you, one of the doctors there at Dermatology Associates and Surgery Center. Can you run down the locations for us?
Yeah, so I'm located in the Charleston office. In Charleston, Hurricane, Logan, Beckley, Princeton, Hagerstown, and Martinsburg.
Very good. All right, Alex. Well, we look forward to another discussion with you next week. And thanks so much for being with us today.
Thank you for having me.